Good day, ma'am. I am your student nurse for today, and today we are going to perform preparing sterile field using a commercially prepared sterile kit or tray. Purpose: to prepare a sterile field following the principles of sterile technique. Next, equipments and materials needed. Commercially prepared sterile kit, sterile gauze pad, sterile kidney basin, and normal saline solution. Next, for goal, a sterile field is created without contamination. The contents of package remains sterile, and the patient remains free of exposure to potential infection-causing microorganisms. Assessment: gather all materials needed to save time and effort. Next, check that the package kit or tray is dry and unopened. Also, note expiration date, making sure that the date is still valid. Next, for planning, select work area that is waist level or higher. Afterwards, for implementation, special considerations: wash hands. So before coming here, just wash my hands. And drape mayo table. Next, opening a sterile drape. So first, we're going to remove the sterile drape from the outer wrapper and place the inner drape in the surface of the work surface, or at the waist level, and the outer flap facing away from us. And next, touching only the outside of the flap. So we are going to reach around the sterile field to open the sterile flap away from us. And next, open the flap sides using the same manner. So I'm going to use my right hand for the right flap, and left side for left hand. Then open the innermost flap that faces us or faces you carefully, that does not touch our clothing or any object. Next, adding sterile supplies. So we're going to open the unsealed edge of prepackage, the sterile supplies, taking care not to touch the item or the sterile supplies with our hand. Then we're going to hold the sterile supplies 10 to 12 inches above the sterile field, and we're going to allow the object to fall at to the middle of the sterile field. Next, our sterile supplies are added by holding with the sterile object with our hand, and the other hand will unwrap, and we're going to carefully drop to the object into the sterile field. And next, we're going to fix a little. Afterwards, pouring solution on the sterile field. We're going to check first the label and the expiration date of the solution, and note any signs of contamination. Next, remove the cup and place it facing up into the flat surface. Make sure not to touch the inside part of the cup and the rim of the bottle. Next, we're going to pour the small amount of solution into the sink or into the waste receptacle, or this is done when we are pouring weak solution like uh, normal saline solution and distilled water. Next, hold the solution bottle 6 inches above the sterile field or above the receptacle, and we're going to pour slowly to avoid any spills. Afterwards, recap the bottle and place it outside the sterile field with note the date and time when it was open and if it will going to be reused. Next, add any additional supplies. Following the sterile technique. And then do sterile gloves before stating the procedure. So before doing the procedure and gloving, we can have fix the other items in the sterile field. That's all. Thank you.